Assalamu alaikum. Ultrascan Diagnostics said this is the CBCT of the patient who had requested the area of interest is the upper and lower jaw for implant placement. This is the panoramic view. Very limited bone is available, as you can see. This is the transaxial view. The transaxial view is basically the proximal view, and here we'll show you both the upper and the lower jaws for any areas where implant placement is possible. Now, moving in the anterior region, this is the central incisor region. In the central incisor region, you can very clearly see paper thin ridge. The width of the ridge is not more than 1 millimeters, and implant placement is going to be extremely challenging in this region. Approximately 7 or 8 millimeters below the existing crest of the ridge, we have approximately 3 millimeters of width with approximately 7 millimeters of height. So this is in the anterior region where we have some form of bone available. This is the upper left anterior region. Here we do have some bone, 3.6 millimeters of width with 11 millimeters of height. So the upper left quadrant, central incisor region, we do have some bone. Upper left quadrant, lateral incisor region, again we have not very good bone, but 2.5 millimeters of width with approximately 10.5 of length. Mid crest, we have 3.4 millimeters of ridge width. Moving to again the canine premolar region, absolutely limited bone here. If we go approximately 8 millimeters below the crest, we have 3.6 millimeters of width with approximately 7 millimeters of height. Moving to the molar region, as you can see, the sinus has pneumatized. The ridge is 3.3 by 4 millimeters of length. Sinus lift procedure can definitely be attempted in this region. But the posteriors have absolutely no bone whatsoever, 2 millimeters of width with approximately 3 millimeters of height. Moving to the upper right segment, so this is the upper right segment. Here we've got some bone, 3.6 millimeters of width with approximately 11.9 millimeters of height. This is the upper right lateral incisor region. The upper right canine, again, the ridge becomes very thin. The premolar region, ridge becomes thin. The molar region, the ridge is absolutely non-existent. Now, this is the lower right molar region. Here we have approximately 6 millimeters of width with approximately 4 millimeters of maximum height to the inferior alveolar nerve. This is the maximum height that we have. If I can show you slightly more, we might be able to extend it. So we've got 5.5 millimeters of maximum height above on this region above the inferior alveolar nerve. This is the molar region. When we move towards the premolar region, again, this is the maximum height we have, which is 5 millimeters, with the crest being 5.4 millimeters. Moving to slightly more anteriorly, we've got 4 millimeters of height with a good 5 millimeters of width. Canine region, we've got very good bone here. The best bone that we've seen so far, 7 millimeters of width with 8 millimeters of height in the canine region. We've got another just anterior to the canine. That was the first premolar region. Sorry, this is the canine region. If we remove the sharp bony ridge, we've got 5.4 millimeters of width with a good 10 millimeters of height. So first premolar and the canine, we've got some excellent bone. In the anterior segment, we have very limited bone. Either denser burrs will need to be used because we only have 3 millimeters of width, but we do have a significant 10 millimeters of height in this region. This is the lateral incisor. The central incisors are absolutely paper thin ridge. Wouldn't suggest placing an implant here. Moving to the lower left canine region, again we've got slightly good bone here. Approximately 4.6 millimeters of width with a good 10 millimeters of height. First premolar region, again excellent bone, just anterior to the mental foramen. We've got 7.9 millimeters of height and 5.9 millimeters of width. Distal to the mental foramen, we unfortunately have good bone width but absolutely no bone height. So distal to the mental foramen, on both sides of the lower jaw, we would not suggest placing implants, as there is absolutely no bone. Anterior first premolar canine, on both the sides in the lower, there is definitely place for excellent implant placement and an implant supported denture in the future. Thank you very much.